Hello, I'm Carolyn Merriman and I teach health assessment. I want to present to you today the head-to-toe performance exam. So I will be doing it in two different ways. I will be using a volunteer patient as well as showing you more specific placement sites for the auscultation of the lungs and the heart and the abdomen on a model. So you will see in a few minutes the head-to-toe performance exam on a person that's volunteered. But to do the details and to keep the integrity of that person, I will also be demonstrating on a model. You will be doing it on a patient, a volunteer, a lab partner, and I want to show you either whether I'm using a live volunteer or a mannequin, that you can do that with integrity by draping and keeping your patient secure and confidential and making them feel like that you care about that piece of it. So what I'll be using in your packets, there is a head-to-toe examination recording guide, and whatever page it's on in your packet, it varies from semester to semester. You will be able to have this blank form and we will show it to you more specifically, but it's called the head-to-toe examination recording guide. That can be beside you while you're doing this exam. You also should be studying the head-to-toe examination grading criteria, which tells you, it's a 2-column, and it tells you what you do as far as the performance and exactly what you'll do afterwards when you're doing the write-up. So remember, you will be doing the performance exam on your partner. Then you will have, if it's your turn, then you will become the partner and they will do the exam on you. And then both of you will sit down and do your write-up, your head-to-toe write-up. That is what is designed for this. What I plan on doing also is making this a narrative exam. So what I'm going to do as I'm doing the live performance exam is I am going to be talking with my client like you would be talking with your client, but I'm also going to be pointing out to you as the learner some of the tips that we talked about in lab. So when you're doing your actual performance exam in front of your faculty, you do not have to go in and say where all the sites are. You just need to demonstrate what you're doing. All right, let's get started.
Hello.
Hello, how are you?
Well, I'm just not feeling real well. I'll be honest with you.
I'm sorry to hear that. Well, I'm Carolyn Merriman, and I'm going to be your nurse today. And what I'd like to do today is do a little bit of an exam for you, head-to-toe exam. So I'm going to be looking at your eyes and your ears, and you listen to your heart and listen to your lungs and your abdomen, and check your muscle strength, and hopefully we can figure out what's going on with you since you're not feeling well. Would that be okay?
Yes.
Okay. Well, I always ask every client, by the way, before we get started, let me wash my hands. I'm going to use a little hand sanitizer, but I want to do it in front of you, so I've washed my hands. Will you tell me your full name, please?
Susie Jones.
Okay, Miss Jones. Can I call you Susie or Miss Jones, whichever you prefer?
Susie is fine.
Okay. And another question I always ask is, do you know what time of day it is?
It's daytime.
Okay.
It's, midday. 12
Okay.
o'clock.
All right. Thank you. And do you know where you're located right now?
Yes.
Okay.
I'm in the Midtown Hospital.
Okay, Midtown Hospital. Okay, thank you so much. Well, to get started, I think what we'll do is take your blood pressure. And have you had anything to eat or drink recently?
I had some sips of water earlier.
Not a problem. Okay.
Been feeling nauseous.
And you haven't smoked anything?
No, I don't smoke.
Okay. Well, what I'm going to do is take your blood pressure. First thing. Is that comfortable?
Yes.
Okay. Well, it was 130/80 today. So maybe not feeling well, it's gone up just a little bit.
I do have a headache.
All right, so you're comfortable right now. I don't want you to fall, but I'm gonna raise the bed up just a little bit so you're a little bit closer to me. I think I'll start by just looking in your eyes. And I'm gonna use this to do that, and then I'm gonna look in your ears as well. All right, so can you look straight ahead at me? Okay, gonna go on the other side. All right, perfect. Now what I'd like you to do is, I'd like you to look off in the distance, and when I tell you, I want you to look at my finger. All right, look at my finger. Excellent. Next thing I'm gonna do is look in your ears. I'm fighting with this table today. So I'll start on this side. Can you turn your head this way a little bit? Sometimes this cord and I wrestle. It looks perfectly shiny. So no ear infection.
Good.
Yeah. Look in this one. Excellent. No pain or anything in your ears?
No, I just have a headache today.
You do? Okay. On some exams, I'm also narratively talking to my students, but in some exams you can also look for red reflex. And to do that, I would look into the scope and look straight ahead at me. And you see a red glow. Okay? Thank you. All right, what I would like to do also is just while we're at it is look in your mouth. So can you open your mouth, please? I'm looking to side and back. Can you say ah? Stick your tongue out. Now raise your tongue up. Good, and will you pull your lower lip down for me, please? Yeah, it's even though you said your mouth's dry, it looks pretty good. Your lips are a little bit dry. Okay. All right, so we're done with your head and your mouth and your eyes and your ears, and now what I'd like to do is look at your skin. So would you roll your sleeves up all the way to your shoulders, please? Perfect. First thing I'd like to do is just look at your arms, and then I'm going to touch them to see how warm they are and dry. Will you hold them out for me, please? You have a little scab there. You just hit your arm on something?
Oh, I think it's dry skin from the sun.
Okay, looking on both sides. All right, now I'm going to touch your skin just to make sure with the back of my hands that it's warm and dry. I'm going to do it on both sides. It's warm and dry. Well, since I'm up here, I'm going to go ahead and check your pulses, your radial pulse, which is the one right here by your thumb. Same time, I want to make sure it's equal.
Okay.
And since I'm up here with your arms, I'm going to go ahead and have you squeeze my fingers to see how strong you are, as tight as you can. All right, good. Let me look at your fingernails. I'm just pressing on them to check and see how good of a return you have. It's about oxygen and making sure you've got enough oxygen. Perfect. Now what I'd like to do is do your legs the same way. I want to look and touch the first time.
Do I need to slip my shoes off?
Yes, if you don't mind. And if you don't mind your socks. You need some help?
Now, I need a pedicure right now.
I don't care. That's okay. When we all like pedicures too. All right, so if you don't mind, can I take your socks off? All right, I'm just going to take them down where I can look at your toes. You have polish on your toes.
My children have been painting my toes.
They
have. So they're not perfect.
Okay, well, I'm just going to look at your legs.
I didn't shave today.
That's all right. We're not looking for hair. We're just looking for skin lesions. All right, let me just peek. A couple bumps again. One on your I'd note that one.
That I dropped a can on my foot.
Oh my goodness. All right, let me look in the front and the back. A can, I bet that hurt.
And I've been painting.
Oh my goodness. Well, let me touch you now just to see you're warm. I like to do it up here too, but that's all right. Now, so the front is warm and dry. Let me look in the back. It's also warm and dry on the upper and down on the lower. Now that I'm here, I'm just going to press and make sure you don't have any edema. 5 seconds. And you don't have any edema? Okay. Do you ever have swelling in your feet?
I do.
It's okay right now. You could even do, Well, I'm going to just check your pulses. These are your pedal pulses. I'm doing it, they're equal. If I were going to get close to that, I'd put gloves on, but I'm not. I'm going around it. Can you push against my hands like a pedal? Excellent. And I know you've got nail polish on, but I think I can check your cap refill on your toes. It's pretty fast. See, it turns white and then it turns pink again. That's what I'm checking for. Since I touched your feet, I'm just going to sanitize my hands. Not that you're dirty, but I don't want to go back and touch your skin without doing that. All right.
I did shower today.
Okay.
That's,
I'm perfectly fine with that. Okay, we can put this down.
Thank you.
You're welcome. Well, what I would like to do now is listen to your lungs while you're sitting up. Okay, so to make you feel more comfortable, I'm just going to put this drape over your lap. What I'd like to do is I'm going to place my stethoscope. I've got to do about back and forth about 6 to 8 places in the front, and then 6 to 8 places in the back, and then 1 on the side under your arm, okay? Every time I place my stethoscope, if you could take a deep breath in and out, that would be perfect. Just like that. And don't get dizzy on me. If you do, you just let me know and I'll stop and you can rest. Okay, you can wait till I put my stethoscope down. I think you've practiced great. Now before, I want to also just look at your chest wall. So go ahead and just take 1 deep breath. Perfect. Now what I want to do is measure. So I'm going to measure that the anterior chest to the posterior, that's kind of a measurement here. So anterior to posterior is less than transverse, which is across. That means you've got a normal chest wall. If you were sick, like with chronic respiratory, you might have like what they call a barrel chest, but your chest is perfectly okay. You've got good chest wall. So let's go ahead and listen now. I'm going to listen in the front first. Okay. And I'm going to just pull your gown down just a little bit here. And we always go skin on skin, so you go above the clavicle because there is lung tissue above there. Take a deep breath. Good. Going on the other side because we go side to side to compare lung sounds. Perfect. You're okay? Mm-hmm. Going down to about the 2nd intercostal space, which is between your ribs. Going across now. That's 4. Okay, keeping you covered. There's 5. There's 6. Okay, now to get 7 and 8, 9 and 10, I would need to come underneath your gown, but I'm going to keep you obviously covered. Okay. All right. And so I would put it here, again against skin. Okay, and then I'd come down a little bit more and just, you okay? Mm-hmm. And then 1 more. Perfect. All right. Well, now I'm ready to go to the back. You doing okay?
Yes.
All right. I'm coming around to the back. And I'm going to start up here, really like close to your shoulder because there is lung tissue up here. So take a deep breath. Perfect. Another one. Okay. Coming down by your spine, but not on it. 4. Okay. Again against skin. Okay, that's 6. Two more. Got to go all the way to the bases of your lungs, which is the bottom. 1 over here. Now the last site that I need to get is under your arm. So can you raise your right arm? Perfect. All right. You still comfortable? Well, what I'd like you to do now is, if you don't mind, is to lay in bed. And I'm going to put your head up. I'm going to do your heart exam next.
Okay.
I'm going to come over on this side and listen to your heart. So what I'm going to do first, because we always inspect first, is let me just pull your gown down just a little bit so I can just see, keep you covered really well so nothing is showing. But I'm looking across your chest and down because I want to look to see if you have any heaves or lifts or pulsations. That might mean that you've got some kind of activity in your heart that might be unusual. Okay, now I'm going to listen to your heart. I'm going to listen in 5 different places, and then I'm going to need to listen for a full minute to take your pulse. Then I'm going to turn and listen with the backside, which is called the bell. So it takes a little long. That doesn't mean anything is wrong. Okay?
Okay.
So I'm going second intercostal space on the right side to start. And then right across, same place. Second intercostal space, but it's on the left border. And then the third intercostal space is Erb's point. Okay. Well, at this point I need to get a couple more, but I'm going to cover you. And then I'm going to bring your gown up and your blanket to make sure that you're well covered. Okay. So we can just keep your private. So that was third. I'm going to do the 4th to 5th intercostal space, which is the tricuspid spot. And then mid-clavicular line, 5th intercostal space, is the apical, or it's also called the mitral spot. Listen for a full minute for a pulse. Get my watch out here. Okay. It's been a minute. Now I'm going to turn my stethoscope around and go back the same way. First, I'm going to listen mitral, mid-clavicular, 5th intercostal space. Then come up to the 4th intercostal space along the left sternal border. After I've done those 2 sites, cover your patient. And then now I'm going to take your gown back down again. 3rd intercostal space is Erb's point. 2nd intercostal space is pulmonic. And then 2nd intercostal space on the right side is aortic. All right, so your heart sounds really good. What I'd like to do now is check your abdomen out, if that's okay. All right, so do you have any pain today in your abdomen?
No.
Do you have any need to go to the bathroom before we start?
No.
Okay, what I'm going to do is lower this gown or this blanket and then just expose just your belly. So I'm going to raise your gown up to here. All right, before I touch it, I just want to look. Awesome. Looking for any pulsations again or any waves, anything that could be in there. All right, now I'm going to listen to your belly. Well, I had it on the bell, so I got to turn it back to the diaphragm from the heart exam. I'm going to start down here on the right side. It's in the lower quadrant. Okay. Going kind of in a clockwise position. Listening for bowel sounds in each quadrant. All right. Your bowel sounds are regular, so I call those normoactive. Now I'm going to just slightly with one hand touch your belly. You let me know if there's any tenderness, okay? Kind of a light touch. Okay, now I'm going a little deeper. Any tenderness so far? Okay. Perfect. All right, that concludes our abdominal exam. Do you mind sitting back up again on the side of the bed? I'm going to take the bed down so that you don't fall. Well, this last thing we're going to do, I've already checked your strength in your hands and your feet, so I just want to check your back to make sure that you don't have any problems with your back. So I'll keep you covered down here for a second. So this would be a bare back, but I'm going to just touch it first, okay? I'm kind of looking to see if you have any any deformities, which sounds kind of horrible, but make sure your back is good and straight. All right, now I'm going to touch it. Are there any areas that are tender here? Any areas that are tender? Okay. Can you back up just a little bit, and I want you to, if you can you bend down and touch your toes? Okay. And slowly come back up. All right. All right, perfect. All right, you may sit back down. And let me just check my paper, make sure I've got everything. I think this concludes our exam today. Thank you so much, and I will record my findings and let the healthcare provider know. Thank you so much, and I'll see you. Call me if you need me. All right, the call light is here, and I'll be back. All right, thank you.